Welcome to the Positive Choices webinar series. My name is Tara Google and I am the Project Manager for Positive Choices, and I am based at the Matilda Centre for Research in Mental Health and Substance Use at the University of Sydney. Welcome and thank you to our audience for joining us today. We are all coming together from different parts of the country today, so I'd like to begin by acknowledging the traditional custodians of country throughout Australia and their connection to land, water and community. I am currently on the land of the Gadigal people of the Eora Nation, and I pay my respects to their elders past and present. I further acknowledge the traditional owners of the land on which you are on, and pay my respects to their elders past and present. I'd also like to acknowledge any Aboriginal and Torres Strait Islander people joining us for the webinar today. Before we get into today's presentation, I'll just go through a few housekeeping points. As participants, you are currently on listen-only mode, which means that we will not be able to hear or see you. And we are recording this session and it will be made available via the Positive Choices website along with the slide handouts. We're going to have a question and answer session towards the end of the webinar, so please feel free to add your questions to the Q&A box and you should be able to see that one on your screen. And if you're new to Positive Choices, let me just give you a quick introduction. Positive Choices is a website that aims to provide evidence-based alcohol and other drug information that is up-to-date and accurate. We have resources suitable for parents, teachers and students. And I would encourage you to visit our website to access a range of evidence-based resources, and our webinars are part of this. And you can also access recordings of our past webinars via the website. Now, today's webinar is on e-cigarettes and vaping and will be presented by Professor Hayden McRobbie. Professor Hayden McRobbie is a health behaviour change expert with a special interest in tobacco and obesity. Hayden graduated with his degree in medicine and surgery from the University of Otago, and after working in general medicine and surgery for 3 years, he moved to the UK to work in Tobacco Dependence Research Unit. And while working in this unit, he completed his PhD in medical psychology, which focused on tobacco withdrawal symptomology. Hayden is an experienced researcher, and one of his main areas of research is the treatment of tobacco dependence, and with a current focus on electronic cigarettes and digital strategies. He is a professor at the National Drug and Alcohol Research Unit at the University of New South Wales and a consultant in lifestyle medicine at Lakes District Health Board in New Zealand. So thank you very much, Hayden, for joining us today, and we're very lucky to have you. I'll now pass over to Hayden.
Thank you very much for that kind introduction, and welcome to everyone online. We're all getting used to these online events more now. So hopefully that all looks good and you can see the first slide there on electronic cigarettes and what you need to know. Now, I'm going to preface this by saying I'm sorry if there are some technical bits as we go through. I will try my best to explain everything in a little bit of detail so it's not so confusing. But my apologies in advance if there's something that's just all gobbledygook. So then let's first off start by just having a quick refresher on what electronic cigarettes or e-cigarettes or vaping devices, this is all the same, multitude of terminology used to describe the same product essentially. And these are all battery operated products. They heat and aerosolize, or vaporize if you like, a liquid that usually contains a mix of propylene glycol, vegetable glycerin, some sort of flavoring, and very often the case, nicotine. But not all electronic cigarettes contain nicotine, and their concentration varies, which I'll talk about in a minute. Now, when I first started getting involved in electronic cigarettes, most were of these sort of first generation or cigar-like type devices. But then over time, the technologies continued to evolve. And now we've got these fourth generation or pod type devices, which are possibly the most popular among young people. They're quite cool looking, they're light, very easy to use and can use discreetly as well. Now, in terms of nicotine, just a quick refresher. Remember that nicotine is contained in the tobacco leaf. There is a nicotine salt. when you smoke tobacco leaf, dried tobacco leaf, it's often mixed with ammonia to increase the alkalinity, which means more nicotine can be absorbed, or it's better absorbed. And nicotine is very quickly absorbed from tobacco smoke and reaches a part of the brain, again quickly, that's involved in rewarding behaviour. It's the mesolimbic dopaminergic pathway. You don't need to remember that, but know that taking a puff on a cigarette delivers nicotine, and that rewards the behaviour of smoking. And so you can imagine smoking over years and years, multiple numbers of puffs per day. It's a very highly entrenched behaviour. Now, nicotine's not the harmful stuff for smokers. People, smoke for the nicotine, as the saying goes, but die from the tar. It's the burning of organic material that causes most of the harm, as opposed to nicotine. But the nicotine is what they're dependent or addicted to. Now, nicotine delivery, as I mentioned, from a cigarette is very quick. And you might ask, well, how well do e-cigarettes deliver nicotine? Well, they deliver nicotine much more like a cigarette than any of the nicotine replacement products that we use to help people stop smoking, such as the patch or the gum or the lozenge. Now, this graph here, and I'll show you another one soon, is showing nicotine delivery from either cigarettes, shown in this light blue line here, or a range of different e-cigarette products containing nicotine. Each different color line is a different product. But what you can see, I hope, from this graph is that all of these e-cigarette products deliver nicotine and peak within 10 minutes or so, very similar to a cigarette. Now, that's great if you're using them to help people stop smoking, but more risky if they're in the hands of people that don't smoke, because of the potential for becoming addicted to these products. And I just wanted to mention Juul at this point. Some of you may have heard about this device. It has created quite a stir in the US. And this is an electronic nicotine delivery system that delivers nicotine very well. And here are some data here. Again, this is blood nicotine delivery over time. The solid line is nicotine delivery from a cigarette, and the dotted line is nicotine delivery from a Juul device, one of these e-cigarettes, in the hands of experienced vapors. And what you're seeing here is, if you know how to use this device, you can get nicotine levels very, very similar to smoking. Again, great if you're a smoker trying to switch and stop smoking, but not good if you're going to pick this up and persist with it. And the possibility is that it could become addictive. Now, there's some controversy, as you're all aware of, in this field. And so I just want to, first off, just looking at some trends in e-cigarette use in Australia. And these data are from the National Drug Strategy Household Survey 2019. So already a little bit out of date, but I hope it will show you some of the trends we're seeing. First off, some good news. Smoking prevalence in Australia continues to decline. Now, Australia's got some of the best tobacco control policies in the world, was world leading in many aspects of tobacco control. And so you're seeing this ongoing decline in smoking prevalence, and an increase actually in never smokers as well, which is good to see. But we've also seen that e-cigarette use has increased over time. And these are just two time points, 2016, 2019. It would be nice to have some more recent data. And what you're seeing here is current use. And current use is defined as daily use, weekly use, at least monthly use, or less than monthly use. So, if you had a puff once a month or something like that, you'd be counted as current. People that used to use them but no longer do, use them only once or twice and never use them. And you can see here there's a decrease in never use and an increase in ever use. And that's typical, and it's happening in many other countries. In terms of who's using them, I think the good news here is at this time point, the vast majority of never smokers have never used an e-cigarette. That's still shown here. Okay. Most use is happening in people who smoke, which I think is reassuring. But among young people, we're also starting to see this increase, again, mostly in smokers. So this is 15 to 24-year-old young people who smoke, and you can see the increase in the use of e-cigarettes between these two time points. Here's your older age group. And then here are the non-smokers. So we are seeing an increase in current use in non-smokers as well. Still fairly small in terms of overall percentage. But the question is, why are non-smokers using vaping products? And we'll come to this later on. Similar story here in New Zealand. This is the year 10 survey. So this is vaping and smoking in 14 and 15-year-olds. And you can see here over time, ever use of an e-cigarette has gone up. So in 2019, it was 37.3% of 14 and 15-year-olds, with still a decline in ever tried a cigarette. Daily use of e-cigarettes is still quite low, but higher than daily smoking. Again, the most worrying scenario in all of this would be daily vaping and never smokers. So people have never smoked that are now vaping or using an e-cigarette on a daily basis. At this time point in 2019, it was under 1%, which is quite similar to that we might see in the UK, but not completely negligible. Now, you won't be surprised by this, but when you ask people why they use e-cigarettes, most of them are out of curiosity, and that's especially true for a never smoker. They just try them because, well, why not? And then the next biggest categories here are to try and help you quit smoking, and that's primarily, as you'd expect, in people that currently smoke or are ex-smokers. Now, the whole, well, perhaps part of the controversy in all of this is that there's sort of two sides to the story. Could e-cigarettes help people stop smoking? Well, that would be a good thing. And we'd all like to see more people who smoke quit. And so vaping might be a way out of smoking. But we have to balance that with preventing uptake of vaping in people who don't smoke. And so you'll often hear two different sides to the story, depending on where people are coming from. If you're like me and work with a lot of people who smoke, then obviously I'd like them to do whatever they can to not smoke. If you're in a school-based setting where people don't typically smoke, then e-cigarettes are not necessarily a good thing. So just to answer the question, do e-cigarettes help people stop smoking? We have a review, a paper, a systematic review that's updated on a regular basis. So we really work hard to try and keep this up to date. And overall, I'll just give you the headline results, is that yes, e-cigarettes can help people stop smoking, but they're no magic cure. So for example, out of every 100 people that try using an e-cigarette to help them stop smoking, around 10 to 11 will stop smoking long term. Now that's a little bit better than using patches or gum or lozenges or those nicotine replacement products. But again, no magic cure. But answering that question, yes, e-cigarettes can help people quit. In terms of their side effects, there are some common side effects associated with vaping, mostly local: throat and mouth irritation, cough. Some people feel a little bit sick, and some people get headaches. But in most of these studies, we haven't seen any serious adverse events in people using nicotine-containing e-cigarettes in these studies. So are e-cigarettes safe? I try not to use the word safe here. I prefer to say, well, no, they're not 100% safe, but overall, they're less harmful than smoking. So if you're a smoker, obviously switching to vaping would be less harmful. But there are substances in e-cigarette products that are potentially harmful. And for example, when you're heating the liquid that is used in these devices, if you heat it to high enough temperatures, you can form things like formaldehyde or acetaldehyde, which can be carcinogenic. Because the batteries and the coils are made of metal, you can get exposure to metal and other products like lead and tin and silicates. And then you've got the components of the liquid, which can include nicotine. And if you can get nicotine poisoning, of course, if you took too much nicotine. But I think some of the perhaps substances we'll find to be most problematic will be the flavoring. And we already have an idea with some of the flavors, such as the one that gives you cherry flavor is benzaldehyde, cinnamon flavors, which are the cinnamaldehydes, are irritant to the lining of our respiratory system. So those particular flavors are certainly not so good, and who knows, over time might be found to cause some harm. Also, adding some substances to vaping products can be very harmful. And we saw this in the US in 2019. Some of you may have heard of Vale. This was the e-cigarette or vaping product use associated lung injury. And in the US, and it was confined to the US, there were almost 3,000 cases of quite severe lung injury associated with e-cigarette use. Now, later on, they discovered that this was found to be related to vitamin E acetate. And this substance was being used as an additive, most notably in THC containing e-cigarette or vaping products. So it was being added to cannabis liquids, and it was used to sort of thicken it and make it look more like the true cannabis liquid, and that was what was causing the harm. So we do have to be careful there. So overall in health risk, I think what I really want to try and communicate here is that, and I'm not putting numbers in because I don't think we truly know, but if you're a smoker who switches to vaping and completely stops smoking, then there is going to be a reduction in your health risk, undoubtedly. How much reduction, we're not quite sure, but there will be reduction. If you're a never smoker who becomes a regular vapor, then there's likely to be an increase in health risk. Again, we're just not clear on the health risks of long-term use. But if you're a never smoker, best not to start vaping to later discover that there's some health risks associated with that. Now, various organizations have tried to communicate this to the public, but and this is Cancer Research UK, mainly aimed at people who smoke to switch. So that's where most of the focus has been. Hey, look, this is much safer than smoking. But I do wonder whether some of the messages have been lost in translation, and understanding relative risk may be the problem. Less harmful than smoking does not equal safe. And I know when I've talked to some young people or parents of young people that they've heard the message that this is safer than smoking. So it's okay if my child starts vaping because it's safer than smoking. Yeah, it's only safer than smoking if your child was already smoking, of course. And so this is the challenge, I think, in really trying to communicate risk adequately. Now, I think that many of you will probably say, yes, we do have a growing problem with appeal to young people. But there are some points and questions to consider here. Often the surveillance data that we report on are a few steps behind. I've already showed you data up until 2019, so we're in 2021. What's changed? The measurements of e-cigarette use vary, so we do need to just be a bit careful of what's being reported. Someone that's just tried vaping and has never ever touched it again is very different from someone who's vaping on a daily basis. And we also need to consider policies and regulations when comparing data from different countries. For example, in the EU, whilst e-cigarettes are allowed, it bans, there's legislation to ban advertising, restrict sales to minors, and it also limits the nicotine concentration in e-cigarettes to 20 milligrams per mil. In New Zealand, we do have legislation in place that does restrict sales to minors, does ban advertising, but there's not the same limit on nicotine levels. So that might be something that will give us some difference between countries. And the other question too is, are youth who vape those who would have tried smoking? This is quite a difficult question to answer. But some would say, well, you know, often people who vape are sort of the risk takers and they probably would have tried smoking. I'm not quite sure whether that's true in this area. And early on, I think the vaping industry hasn't been squeaky clean here. And there have been some examples here, which I would say were very much directed at young people. These advertisements don't exist anymore. But there you go. That was certainly the case in the US when Juul, I talked about Juul earlier, and there has been quite a problem with young people who don't smoke that have become Juul users. And there's some recent research published on this, you know, the use of Juul and other pod type devices. So these are the pod devices where you just slip in a pod. And users often, a bit like smoking actually, often sort of find their first experience to be a bit negative. You know, the harshness of the nicotine is not particularly pleasant, but some do persist with use. And reasons for continued use are stress relief and addiction. So, you know, they use vaping to help manage stress, a bit like smokers often report smoking to manage stress relief. Neither are good stress relievers, not a good way to cope with stress. But then once you become dependent or addicted to nicotine, it makes it hard to get out of it. You've got this drive or these urges to vape that will continue you vaping. But there are also some other factors, social and environmental, which I think we need to take into account. So peer and parental influences, both positive and negative. So parents who set down the rules and say, no, vaping is not something that a non-smoker should do. This is not, you know, not something for us, versus parents who might be a little bit more laid back about it, or perhaps think, well, it's safer than smoking. It's better off going down that route. Lack of support for quitting vaping. Obviously, if that support's not there, then you carry on vaping. And the accessibility of the products as well. In terms of environmental factors, what came out of this study was the contrasting messages about long and short-term health effects. So perhaps young people are a little bit confused with the messages, and I don't blame them, especially when you're coming from two different angles of helping people stop smoking versus preventing people from starting to vape. And then the lack of school vaping policy and enforcement of that policy, perhaps health education and cessation resources are lacking as well. And does policy matter? And I'm talking about government policy or national policies here, or state policies. Yeah, I think it does. And I mentioned the EU Tobacco Products Directive limiting nicotine concentration. And there's some more data here just out that young vapers in England were not only much less likely to report using e-cigarettes with nicotine over 20 milligrams per mil or over 2% compared with Canada, where these products are available. But youth vapers in England were also less likely to report signs of dependence compared to those that were vaping high nicotine products, were more likely to say they had greater symptoms of dependence. So they were more likely to have urges to vape. So yeah, I think we can really get some good policy in place to help reduce the risk of uptake in young never smokers. And I think it's clear that vaping can lead to nicotine dependence. You saw the data at the very beginning of this talk showing that some products, not all, but some, and I think especially the Juul products, can give rise with some practice to quite decent levels of nicotine absorption, very much like smoking. And not only do they become dependent, but There's an ongoing cost associated with vaping, of course. If you're dependent and you have to vape, that's going to cost money. And with ongoing vaping, again, it's the exposure to the other chemicals. And although they're less than smoking, there's still that risk of exposure. And as I said, the risks of long-term vaping still are unknown. We're a bit over a decade now of regular vaping in people, and so far there haven't been any major concerns that have come to light, but I think we're still too early on in the trajectory, I think, to understand the real risks. So strategies to prevent or reduce the use of vaping in young people. Well, something I think we could all do would be to review our existing school tobacco policies and how we, in most schools, don't allow smoking, obviously. But I think trying to weave in the vaping here as well would be useful. A lot of the school nurses that I'm talking to at the moment are asking for help. What do we do when we've got kids that are dependent on vaping? What do we offer them? Well, I'm afraid there's not a whole lot at the moment. We're only really starting to understand what we could do to help people stop vaping. So I think prevention is still the best part at play here. Possibly some more staff training within schools. Interested to hear what you think about that, to try and get the messages right, and probably increasing knowledge through some public education campaigns would be helpful. And look, we've already started in the Asthma Foundation in New Zealand. On the left of the screen there, that's one of theirs. Don't get sucked in. Heavy metal belongs in your ears, not in your lungs. And in the US, they've also got some campaigns to try and prevent uptake of vaping in non-smoking youth. People are starting to look at what could be done to help people stop vaping. This study from the US looked at text messages, sort of a text message intervention to help people quit vaping. At 7 months, they had some promising results, but I think we really do need some more evidence here. But maybe we'll be able to take a little what we know of how we help smokers to quit to help those who vape that want to get off the vaping to do so as well. So I'll finish here just with some key messages to try and summarize all of this. Whilst e-cigarettes are less harmful than smoking, they're unlikely to be harmless, especially with long-term use. And I can't reiterate this enough. People who don't smoke should not use e-cigarettes, regardless of the nicotine content too, by the way. I know some will say, oh, but it's got no nicotine in it. I think the message can just be clear. If you don't smoke, you don't vape. And young people who have not smoked and are vaping should be advised to cease e-cigarette use and not smoke cigarettes. We don't want them to go in that way either. E-cigarettes may help people to quit smoking, and so those messages are probably going to still be out there. My view on e-cigarette use and helping people quit, ideally, I think they should also stop vaping when they feel that they won't go back to smoking. I think for all of us, getting the different messages to these different groups right will have some challenges. But I think with some good policies and regulations in place, it should be possible to find the middle ground on this and keep vaping as an option, as a way out of smoking for those who do smoke, whilst preventing, or at least if we can't prevent completely, at least substantially limit use in young people who do smoke. So I'll stop my screen share there, and happy to take any questions. I see I've already got some. Do you want me to start going through this list, or do you want to call some out and we'll answer them?
Yeah, sounds good. Thank you so much, Hayden. It sounds like there's still so much we need to know in this area as well. We've got a bit more evidence from the past few years, but definitely still gaps with things to answer. And yeah, I can start going through some of the questions. So just so people know, we've got over 1,000 people joining us at the moment. So we'll try our best to get through as many questions as possible, but maybe we'll start with this one. And it's, can you please update us on the way students are engaging in this behaviour without teachers and adults being aware?
Well, that's not surprising. Teenagers engage in lots of behaviours without anyone being aware. And vaping's perhaps no different in that they're going to try these things. What the concern is that they go on to vape on a regular basis, and that's what we want to try and avoid. I don't think we can avoid completely them trying stuff.
And then another one here is, do e-cigarettes create tar?
That's one of the advantages of e-cigarettes. They do not create tar. So tar is pretty much it's created from burning organic material, and that's what causes the harm. And that's why we know that e-cigarettes for people who smoke are less harmful, because they don't contain the tar.
And then you sort of touched on this at the start, you talked about nicotine, but maybe you could tell us some of the harms of nicotine, or just go through a few more of those.
Yeah, so overall, nicotine in large doses can be harmful. You can get nicotine toxicity. We have seen that in the past. But generally, the first symptoms that you start noticing are nausea and vomiting. If you carried on taking large doses, then it can be more severe outcomes. In very large doses, especially for younger children, it can be fatal. So I'm not saying nicotine's completely harmless and you want to keep it out of the reach of children. For people who smoke, as I mentioned at the beginning, nicotine's perhaps the least of their concerns. It's the stuff they're addicted to, but it's not the stuff that's killing them. In terms of people who don't smoke and perhaps young people, there have been some concerns put forward in that it might alter brain development in young people. Those data mostly come from animal studies, so it's a little bit difficult to try and translate animal studies to humans. And I think that's just the nice, easy way of saying, well, if you don't smoke, don't vape.
And then maybe just you could touch on some of the different products. So there's a question here that says, is a vape mod different to a disposable vape?
All of these different vaping products vary in, a whole host of things. In terms of some of the mods don't need such high levels of nicotine because they're more efficient in aerosolizing it. The mods obviously have a bigger battery, typically used by experienced vapers. Your pod type devices are typically very easy to use. They're often in that, nice, easy to use in your hand. Just have a pod, which you just pop in to place. So easy to use, but perhaps also some good safety features around it, and that you're not handling nicotine as well. The pod devices usually, not always, but often have much higher levels of nicotine in terms of the salts, but that doesn't necessarily translate into that's how much you absorb when you use them.
And we've got another one here that has vaping been linked to high levels of triggering of epilepsy?
I'm not aware of any evidence that shows that vaping has been absolutely linked to causing epilepsy or even seizures. You can experience seizures with very high levels of nicotine, as an overdose. But again, as I mentioned earlier, you'd be much more likely to get some of the nausea and vomiting. I have seen reports of people that have been vaping and that have had seizures, but we can't determine causality of that based on the reports that we've seen. And remember, in all of the trials we've had so far, we haven't seen those links.
And we're getting a few questions coming through about passive vaping. So is there any research on passive vaping or the harms from passive vaping? So that secondhand smoke kind of idea.
Yeah, I'm not aware of a lot of research looking that sort of can confidently show any harms of secondhand vapor. And again, from a sort of proportionate risk approach, any harms of secondhand vapor are less harmful than secondhand smoke. But I can't say with all certainty that would be harmless either. So I think more evidence there is probably needed to understand that.
Definitely. Sort of another question that might come down to that, more evidence, but For non-cigarette smokers who vape, what are the health risks of vaping beyond becoming addicted to nicotine? Is it mostly related to the unknown risks associated with flavourings?
I think flavourings will play a major part in risks. What we do know is that, and these are from animal studies and cell studies, is vape is not harmless. So we know that it can irritate the cells in the respiratory tract, in the respiratory system, and can give rise to some inflammation. Now, the problem, the concern that we have is what happens over time with constant exposure over many, many years. What will that cause? I think it's the long-term use that is probably going to bring up something, or potentially bring up something that's concerning.
Bit of a watch this space area, I think, still. And then we've got one here that says, is there anything addictive about the ingredients of non-nicotine e-cigarettes?
Good question. And I think that I can't say that I know of any data to show that any particular flavorings are addictive in their own right. But we do know that people have a preference for flavoring. And again, if you're trying to stop smoking, having a choice of flavors is helpful. But we've also seen in the US where they've restricted the flavorings available, especially to young people, to try and limit the uptake. In New Zealand, the restrictions are that if you buy vaping products at a gas station or a corner store, then you're going to be limited to buying mint, menthol, or tobacco flavored. So you won't have the full range of products. You'd have to go to an R18 vaping store to get hold of those.
And then there's a bit of a question that touches on Australia here. So it's, what are the policies and regulations of e-cigarettes in Australia?
Well, Australia, you need a prescription to get nicotine-containing e-cigarettes. So there are, it's probably one of the most restrictive markets, which it is what it is, and maybe that will play out as a good or a bad thing in the future. I don't know. I think we do need to really think about regulation in a really careful way that leaves it open for people who smoke to be able to switch, but has enough regulation in place to prevent, or at least limit the uptake of vaping in young people. And maybe the EU have got this right, and they've reached the right point there, because we're not seeing a great proportion of young people becoming regular vapers there. Whether that's because they've had no advertising from very, very early on, or whether that's the limited nicotine concentration that's done it. I don't have all the answers there, but regulations, or legislation and regulations are really important, I think.
Then with this question, I think we've had a few similar ones. So it's, what's your advice on getting through to these kids that are vaping? My 17-year-old son, a non-smoker, has taken a real liking to regularly using these products. And I think this is a bit of a concern that we have heard from some parents and schools as well.
Yeah, and I understand that, and I'm certainly hearing it from some of the schools here in New Zealand, and some of the school nurses are a little bit stuck with what to do. I think we've got to look at this and look at our messages a little more clearly. I was talking to a 16-year-old from one of our local boys' high schools, who, in his view, the messages from the government have been very much that vaping is safe. That's what he's heard, that's what his friends have heard. That's not quite the message. The message was safer than smoking from a smoker's point of view. But maybe we haven't quite got the messages right at the other end for people who don't smoke and trying to prevent it. I don't think, telling people off or expelling people from school is the way to do this. I think that we should be much more clever in this space and try and work out what messages are needed, talk to young people, and try and try and look at some of the other approaches through education, through school-based policies, through teacher education. I think it's probably going to be a mix of all of these things, as opposed to just banning everything completely.
I think as well, it was a little bit reassuring, some of those stats at the start, that it is increasing, but there are still quite a small percentage of students who are, when you're looking at the large scale, who are actually using e-cigarettes and vape products.
I suspect in the school system, you know, you get a different picture when you're there and you're seeing these kids trying these things. You know, we sometimes only see our own world view, and I think it's about, you know, getting together and talking about this and trying to find that middle ground as we go through.
Definitely. And then there's a question here that says, is there any information on e-cigarette use without nicotine versus with nicotine in Australia, and how are youth getting the vapes?
Well, you know, youth, I didn't quite understand the question about nicotine versus no nicotine, but you can get electronic cigarettes with no nicotine in it. That they are available. My view is it's better to just not vape anything. As I said, it's the rules and policies are going to be easier if you just say we don't vape, regardless of nicotine content. Where are people getting them? I suspect there's a bit of an online market going. It's a little bit difficult to enforce sales. I know on many websites you can just click, yes, I'm over the age of 18, but then that's where that stops. We know young people are quite creative with how they get these things. And look, I don't know, maybe some stores are also selling to underage, and I think this is where enforcement really needs, you know, you've got policy, if you've got legislation in place, then you also need the enforcement arm to make sure that it is been adhered to.
Definitely sounds like a bit more of a regulation of the online market, and also
and
people are buying over the counter.
Yeah, see someone flashing up saying, and yeah, they're not checking IDs and they're just walking in and getting them. And you know, if that's the case, I think those are the things that we can have influence on, just like we do with smoking. You know, we go and we go down and do enforcement of people selling cigarettes.
I guess it's a similar story for alcohol as well. We know many youth can still get alcohol underage. And then another question here is, we are hearing anecdotal reports of young adults quitting vaping after finding it is impacting their lung capacity and sporting performance. Is there any evidence around this?
There's not a whole lot of evidence in young people that we know that reduces lung function. There are some data to show that young people that have tried vaping have had respiratory symptoms. But hey, if kids are saying that's the reason why they're quitting vaping, hey, great. And maybe those are sort of the interventions that we look at that encourage them to do good, healthy, you know, lifestyle changes like physical activity. And one of the positive side effects of that is stopping vaping, then great.
And maybe a bit of a fitting question for those in Australia. There's a question here that says, is there any data on e-cigarette use in COVID, increased rates, etc.?
In COVID?
Yeah, in the context of COVID.
Yeah, I haven't seen data to show an increase in vaping because of COVID, but again, those data are going to be coming a little bit later for Australia. I have seen some data to suggest that smoking increased during COVID, and I think that's the thing we've got to keep in mind out of all of this, is that, you know, this is a continuum of risk, and at one end you've got you know, having a healthy lifestyle, not smoking, not vaping, not using any nicotine products, and at the other end you've got people who are using the most deadly product, that is smoking tobacco, where we have plenty of evidence to show that it causes premature death, illness, loss of function, a whole lot of other things, and we've just got to keep that in mind when we're looking at the whole continuum here.
We've had a few questions coming through about batteries exploding, and I think referring to some of the cases in the US. So there's a question here that said, there have been cases of the batteries exploding. Is this still the case with the Generation 4 pods?
I think less so with the Generation 4 pods, because they're, I think a lot of what we saw with exploding devices, that people were tinkering with them and modifying them. And, you know, when you start playing around with electrical devices, you're opening yourself up to, you know, great risk. Early days, we saw people carrying around the batteries in their pocket with loose change, and then you're getting these batteries shorting and sparking and catching fire and so on and so forth. So I think it's fair to say that as some of the technologies improved, the risks of explosion and other things have got less. But of course, there's a whole range of different electronic cigarettes. You know, some are, I think, poorly made, some are very, very well made. This is not a, you know, they're regulated as consumer products, but we see so many coming in that it's always a little bit difficult to generalize.
And then this next question, there might be one about, you know, having to wait for more evidence here, but it says, is there much evidence for e-cigarettes as a gateway to cigarette smoking for young people or first-time smokers?
Yeah, good question. And this is a really difficult one for the evidence to try and tease apart. In general, most studies have showed that young people who've never smoked that try vaping are more likely to go on to try smoking than young never smokers who never tried vaping. Okay, so, you know, if you're a young person, you try vaping, then you're more likely to go on to try smoking. Now, whether that's because of a gateway or it's just that these young people that tried vaping are just the ones that would be those that try smoking, it's really difficult to tease apart and look at those other factors that these young people might have. And so, you know, trying to look and doing these studies is really, really hard. You could do it if you randomized young people to vape or not, but that's not an ethical study to do. So yeah, you'll see quite a lot of different mixed messages there around that. I can't absolutely say that that is a gateway effect because of all these other factors that we can't always measure. But yeah, overall, people who try vaping are more likely to try smoking at a later time point.
And we've had a few questions come through sort of about vaping and mental health, so I'll just read this one out. It says, one of the retorts young people say to me is that it's the only thing that helps me manage my anxiety. I don't know how much nicotine is in e-cigarettes compared to cigarettes if potential nicotine withdrawal is being misidentified as anxiety attacks. So just a bit more information on short and long-term effects of e-cigarettes on mood disorders or mental illnesses.
Well, that's again another good question. So one of the tobacco withdrawal symptoms is depression, and some people would also say anxiety. And so when you don't smoke, you feel these symptoms, and then you smoke and it takes everything away, which is why people who smoke perceive smoking to alleviate anxiety and stress. It's quite possible that vaping's happening with a regular vapor. When you go without vaping, that you feel some of these same symptoms. The data that I know of in smokers who have switched to vaping, they'd say that actually they get less of these symptoms if they forgot their vape or had to go without vaping. But in young never smokers, that could potentially be a cause. And what you're seeing is the withdrawal symptoms from nicotine. And so therefore they have to keep vaping to keep these things away. However, I think it's also quite likely that these young people do have some underlying stress and anxiety, and how do we deal with that and find better ways to help them cope than picking up either vaping or heaven forbid smoking.
And this one might not have just a straightforward answer, but it says, how much nicotine is in one of the USB style vapes that kids are using?
That is a little bit difficult to answer because it depends on the product. Often these small pod-like devices have higher concentrations of nicotine in. And partly that is because they need those levels of nicotine to get in the device to get the nicotine into the vapor for you to absorb. Nicotine delivery from e-cigarettes is not straightforward. It's not like taking a tablet of paracetamol. It's 500 grams. That's what you get. the amount of nicotine you get from your vaping product not only depends on the amount of nicotine in the liquid, but also how well the device aerosolizes the nicotine, how well the nicotine is absorbed and from not just your lungs, but also your respiratory tract, and also flavors and the mix of propylene glycol to vegetable glycerin also might have a role to play in how much nicotine you get into your blood. So it's not straight. It's not just about looking at what's on the label and going, oh, that's what you're getting. It's not quite as straightforward as that, I'm afraid. But yeah, in general, these pod devices typically contain higher concentrations of nicotine than some of your refillable devices, but it's because they kind of need that to deliver the nicotine that would be satisfying.
And you talked about the dual devices in your presentation. So there's a question here that says, is the dual device used / available in Australia, or is this a US product?
It's primarily a US product, although it is now available in the UK, but at a reduced nicotine concentration to comply with the legislation. I would imagine that you would be able to get this in Australia. You can buy it in New Zealand, but it's parallel imported. So it's not directly imported here by the manufacturer. And I think that's the same with Australia, but there are ways around in getting these devices.
And we've got a question here about the lungs, and it says, does prolonged vaping leave plastic deposits in the lungs?
No, I'm not aware that any vaping device leaves plastic deposits in the lungs. And look, there's a lot of the sort of misinformation out there as well, which doesn't help anyone. And you know, people are right. You know, vaping is not just breathing water vapor. It's not, but it's also not breathing smoke, which is you know, the most risky way of getting nicotine. So yeah, those sort of things, we need to be really clear on some of our messaging.
Definitely. We've still got a few questions coming through around the legalities of vaping. So this one just says, to confirm, is it illegal in Victoria or in Australia to vape in public as a minor / adult, specifically in a school setting? Or is this more of a school policy type issue?
I can't answer that in the state of Victoria. What I can say is in New Zealand, that it's actually legislated that you can't vape in schools, just like you can't smoke in schools. So there is specific legislation for that. I don't know whether the state government have actually put that in as, if it's in as legislation. Often it needs a change in legislation. So it doesn't necessarily, just because you can't smoke in schools doesn't mean that you can't automatically vape. In New Zealand, we had to change our legislation to make that very specific. And separate smoking from vaping. But schools can have policies, of course, that restrict use of vaping, and many do.
And we've got a question here that says, is there any particular e-cigarette that is more common than others, and why?
Again, it depends on the population that you're looking at. We have seen in the US that these pod devices have been very popular among young people, but they're also popular among some adults as well.
And maybe just piggybacking off that one, we've got one that's asking sort of about the costs. So you mentioned the financial burden, but maybe if you could just highlight some of the costs that e-cigarette or pod products are.
Again, these devices depend on, you know, what you're buying and what the product is. There are some that, and again, there's the device itself, and then there's the liquid or the pods that you replace. So most times you're not replacing a whole device. You buy the device and then add the stuff. But in general, vaping would be a third of the cost of smoking. So you can probably work some of that out. But you know, they're significantly cheaper than cigarette use, but not cost-free and not necessarily cheap. I guess from my experience, some of my patients would probably spend maybe $30 to $40 New Zealand dollars at the outset of buying a reasonable vaping product, and then might spend $10 a week.
And it is getting close to 3, so we'll just have a few more questions. So we've got one here that says, which businesses are producing e-cigarettes? Is it the big tobacco companies finding a new way to find customers?
Yeah, good question. Yes, some tobacco companies have bought out vaping companies. That is absolutely true. Whether they're seeing it as replacing customers, maybe. In the early days, it was quite funny, the tobacco industry weren't really interested in this. And in fact, I think many thought that this was just a craze. And most of the vaping companies and manufacturers were completely independent of the tobacco industry. But as time goes on and these products become popular, you've seen some tobacco industries purchase the companies that make these vaping products, either completely or they own a proportion of shares. But on the other hand, there are still a number of independent vaping manufacturers as well. So it's very variable.
And maybe we'll just have this as the last question, might be a nice one to end on. And it says, can you suggest any strategies for schools and parents to help our young people make informed choices regarding vaping?
Yeah, great question. And I think this is where, we can use some of the information that we've got. But I think trying to get our messages right, and getting the messages right will, I think, involve talking to some of our young people to get them to help us to get it right. I think policies at school that are very clear, I don't think they should be punitive and of course expel kids, but there should be some education around, why this is not a good thing to do long term. And making sure parents understand that, for people who smoke, yeah, there's a risk reduction if they switch to vaping. So we've got to expect that some people who vape are doing so because they're helping get out of an addiction that's going to kill them into something that's much less harmful. Whilst at the other end of the spectrum, saying actually, if you don't smoke, don't get into this. Not only is the potential for nicotine dependence and the cost that goes with that, you don't want to go down that route, and also perhaps the unknown health risks that might appear in the future.
Thank you very much, Hayden, and apologies to anyone's questions that we haven't got to. We did have over 300 come through, so definitely hard to get through everything, but hopefully we have covered a range, and a few of them were sort of the same question. And just to finish off, we'll just put some help services and advice on the screen there. So if any of the topics discussed today have been distressing, you can see the information helplines and websites that are available. And thank you again to our audience for joining us today. Please feel free to send us any feedback on the webinar or ideas for future webinars to the info@positivechoices.org.au email address. And this presentation and the slides will be available. And if you registered for the webinar, you get sent a link to that one once it's available. And you can also keep up to date with Positive Choices via Twitter and Facebook with our handles there on the screen. And thank you again, Hayden, for your presentation. I really hope that everyone in the audience was able to find it useful. Thank you again, audience, as well, for joining us. Have a great afternoon, everyone. Thank you. Bye-bye.